Hey, we're welcome back. All right.
Yeah.
Welcome back from the break, and then we have Louis on the phone. Louis.
Hey, Louis.
Hey, Doc, how you doing tonight?
Good. What's up?
Listen, a friend of mine recently had some outpatient surgery for an enlarged prostate. And I wrote down what he told me, everything. It's called Prostiva RF therapy. And what it is, they said it's transurethral destruction of prostate tissue by radio frequency therapy. Now, my question is, what is it and does it work? Okay, that's basically my question. Exactly what is it and does it work? Now, according to what he said, he told the doctor actually burns, I guess, your prostate or something by going inside you. He said, and it's a procedure that supposedly has no ill effects. He says everything's got a possible side effect. He said, but this seems to be a new procedure that's been working pretty well. And that's my question. What's do you know anything about it or heard anything about it?
Yeah, radio frequency is basically the same thing as using high-powered ultrasound to burn the tissue away, as opposed to using a laser. Some of them are using the green light procedure, where they go in and burn the laser, burn the prostate with a laser. The old way they used to do it is they go up into the penis and they put they make an incision in the urethra, and then they used to take a roto-rooter and they would just carve the tissue out. And that worked pretty well. That it obviously lended itself to sometimes being over-aggressive, a lot of trauma with...
I imagine you bleed a lot.
Yeah, bleed a lot, indwelling Foley for a couple of days, and I mean, a real messy procedure. This actually kind of just melts the tissue away, and it takes someone that's doing a lot of them in the skilled hands, because there is a problem with radio frequency being overzealous, and you actually burn tissue that you didn't mean to burn, and so it has to, hopefully the guy who's doing it has a good technique with doing it. Laser, basically pretty much the same way, but they just go in and they just gradually just get all of the prostatic tissue out to the capsule, and that's it. And then you don't have this obstruction anymore, and you urinate like a racehorse. So that's pretty much the way it is. So.
Well, my last question, I'll make it fast. Would you recommend this procedure, yes or no?
Well, a lot depends on the symptoms, Louis. I mean, if you're getting up 3 or 4 times at night and your life is unmanageable because of that, you've tried medication to try and slow the prostate down, try and dilate the bladder, and you're still not getting the relief, then yes, I would recommend any procedure that would help you, because you don't want to backwards pressure up into the ureters, because it can cause kidney damage. You dilate the bladder too much, it becomes kind of flaccid, can't contract, you get urge incontinence. So yeah, I mean, there's a ton of problems from letting this situation go on too long. So I definitely would recommend it, but it depends on the clinical situation, because I don't want you to have a procedure done and yet having a bad outcome, because no matter what procedure you do, there's always risk for a bad outcome. So the cure cannot be worse than the disease. I guess that's the best way to put it. So I guess you hung up or moved on, but I always look at that. Some cures are worse than a disease, and joint replacements, believe it or not, tend to be one of those.
Yep.
Back surgery tends to be one of those, and scar tissue sets in when people get their backs done. They feel good for a while, but then it can set back in. The screws, it's not a perfect world.
No, no, it's not.
And so I had a guy today in my practice who basically has a bad mitral valve. And he looks really great for his age. He's 77, he looks wonderful, he's thin, he said last year he walked the Golden Gate Bridge and around there 3 times. And I said, with every procedure, it's the ripeness. You have to pick the fruit right at the right time. And I said, you don't want to let yourself, I said, the only reason you would put a procedure off is if you knew there was something coming down the road that was less invasive and better. And then you might think about, they were coming out with a new knee procedure, one that was minimally invasive that they could do without tearing your whole knee apart, then I'd say, yeah, it's worth the wait to do that. But what happens is you know, people that have a bad hip or a bad knee, their body melds to that bad joint, right? I mean, if they got a bad knee, they favor it, and all of a sudden now you got a bionic hip and your alignment changes, and now you've got new pain that you didn't have beforehand.
Absolutely. We see that all the time.
Yeah. Because, I mean, if there's an orthopedic doctor watching this show, which I'm sure there probably isn't, I mean, at the end of the day, a lot of orthopedic doctors are technicians, okay? They do their surgery, they do their procedure at the end of the day, but being able to sometimes look outside the whole thing and put it together, sometimes that's not always the case, so.
Chuck.
Hey, Doc, how you doing?
I'm good, man. How are you?
Good. If you haven't seen it, I highly recommend the show Concussion. Based on your football background, I think you'd really enjoy it.
I have seen it. It was an excellent movie.
Okay, great. A question for Dr. Reiner. I've been taking this thing called the GI cocktail, Donatol, lidocaine, and antacid, for quite a while because of the horrible digestive problems associated with the heart, and my gallbladder was so screwed up. Anyway, I only take like a sip before I go to sleep, and like 400 milliliters lasts about a month. And I was wondering if there's any negative aspect to it, taking it in that small amount.
Probably not. I think the lidocaine probably be the only one that would probably be an issue just because it can be at high doses an antiarrhythmic. They give it to people in VTAC and things of that nature. But the Donatol is antispasmodic. And what else did you say was in there?
It's Donatol, lidocaine, and they have antacid.
Yeah. So no, I mean, I'd at that level, no. What percent silocaine is that, or lidocaine?
What kind?
2%, 4%?
I don't know. It says as prescribed by physician.
Okay. Yeah. Well, if you're taking 1 teaspoon or a tablespoon at night and that's it, and it's been working that long, and you haven't had any ill effects now, if it hadn't killed you in the first couple of weeks, you're probably good. So.
Okay, good. Yeah, I need to see you for an appointment. I got canceled a couple months ago, so you owe me $25.
Okay.
So
yeah, I'm going to transfer.
and-
I'm going to transfer one of the patient's credit that should have paid me for the $25, and I'll just transfer it to you. You can go collect it.
Okay, and I'll donate it to the flag man.
There you go.
There you go, Chuck.
Okay, I'll give your office a call then. I need to see you to get it prescribed.
Yes, you do. The lidocaine, everything else is, I think the Donatol, you can, come on in and I'll prescribe it for you. No problem.
Okay, thanks, Doc. Bye.
You're welcome, bud. Yeah, that's pretty funny, yeah. So, we have, I don't know why we do that. We had $25 cancellation fee,
Have you ever collected it?
No. No. I think that when people cancel, they just don't come back.
Yeah.
But it is, you only can see so many people. So, when your day is full, I mean, when you have 4 cancellations, it's just like you think about all the people that wanted to get in that couldn't get in because somebody had that. So I think it's just a courteous thing to do. If you don't want to come in or whatever, give us a call because
Yeah, somebody wants that appointment.
Yeah, somebody needs it out there, and it's just I mean, what I try and do is if I have to leave the office early, I mean, basically what I try and do is I try and move people up forward. I don't try and push them off down the road because then I take an appointment that could have been filled by somebody else. So that's just that's the way it goes. So you saw 70 people today?
Yeah, we try not to leave anybody out.
Yeah, I know. And people walk in to your office all the time and just get seen on a moment's notice.
Yeah, we're pretty flexible.
Yeah,
with
I
what we
think
do.
that's great. And for our viewers, I'm going to be. I'm actually going to be moving my seeing patients. I'm going to be going over to the the wellness office and seeing patients over there, which I think is a much better approach.
Yeah, we're real excited about that. You know,
Yeah.
we're still in the process of putting everything together.
Yep.
When we sit and meet, we sometimes forget we only been doing this for 3 months.
Right.
Seems like 3 years, but it's only been 3 months as we've tried
Well,
to.
you've been here a while doing it,
But to formulate this wellness program, you know, I'm going to be interviewing a dietitian and a nutritional guy to help with those people that want to take 40 pounds off, to help with the diabetes and that.
Yeah, that'll be real.
Yeah, we're going to be putting in yoga into the office. You know, we're just real excited about where we're headed with this, but it's a process. It's a process to get it all set up. It's a process to plan it.
Yeah, we'll be right back.
We got a minute left, guys.
Yeah, we got to go to break, so we got a minute for the segment, for this segment.
Thank you.